So I'm back today, but I haven't been here in forever, and I think I might have deleted some of the videos that I've posted before my surgery, and well, not that anybody's seen it anyway, just for me to me. Anyway, so I've just had my heart surgery, and I had my surgery about 7 weeks ago now. So I'm on the process of recovering still. It takes up to 12 weeks to fully recover. My plan was to kind of vlog something, because before having my surgery I was looking everywhere to see if there was anybody talking about, you know, what they went through and how it was, how it, you know, how they recovered and everything, and I could never find anyone online that was like exposing everything. So I thought, you know what, I'm going to be one of those people that does it, and obviously it's impossible. You can't do it simply. Well, I couldn't do it anyway. So yeah, I had a congenital heart disease that I found out about 5 years ago. So it was a long process to find what exactly I was born with. They had found certain things around the heart that was broken, like my valve and everything else. I was given a lot of like misinformation from the doctors. They said, oh, if you don't spend the next 5 years of your life taking these pills, you're not going to survive and all that. So I was pretty scared, but by the end of 5 years they found that I was born with this problem, not that one, and so on. Anyway, one of the problems that I was born with is called Atrial Septal Defect, plus I had my pulmonary vein connected to the wrong side of my heart and a few other things. And obviously some things happened in my life due to the problem that I had that they couldn't figure out what it was for 4 or 5 years. Anyway, fast forward to July this year, I had my heart surgery. It was an open heart surgery. I went to hospital on a Wednesday. I was supposed to be in the intensive care unit for 2 days, and I spent a total of 10 days in hospital. I had my heart surgery done in Liverpool, Liverpool Heart and Chest Hospital in the UK, and it's one of the best hospital in the world, if I'm not wrong. I was told it's the 3rd best for this type of congenital problems, but I've not done my research, so don't quote me on that. I was just told that by another cardiologist that I had consulted with. Anyway, yeah, I have to say that they were very, very nice. The staff, the nurse, everything was like, it was a great experience. Like, I've never been treated so well in a hospital before. What else? So basically I went into hospital on a Wednesday. On a Tuesday night. I had my surgery on Wednesday morning. It was the first case in the morning. I was had my surgery at 8 AM. So before your surgery they give you like a little pack of, I don't have it now because obviously I've used it. They give you a little pack of things to take care of yourself. So you have like a soap and a nose gel that you have to use prior to your surgery to kind of like, you know, disinfect and all that. So they prepare you before your surgery and after your surgery as well. So yes, I woke up on Wednesday morning, took a shower right before the surgery, showered with my special gel, and yes, went in to say goodbye to my husband. I was super scared because I spent 5 years getting worse and worse day by day. So I was convinced that I was not going to come out of this alive. So I was really scared. Said goodbye to my husband and my family on the other side, and I was like, okay, that's it. So yes, I went into the theatre, and obviously once they put me under anesthesia I couldn't, well, obviously I fell asleep straight away, and I just remember waking up. So my surgery took 5 hours. yeah, 5 hours and something, and I just woke up with this tube in my throat and everything. I'll try to insert pictures in these videos and try to explain as I go. Yeah, so I had a tube. Oh, obviously I had a tube on my throat and all that, so I wake up and I'm like, where am I? So I start coughing, and then they're like, okay, you have to calm down because you have to breathe by yourself first, otherwise we can't take the tube out. So like, okay, fine. So I calm myself down, they take the tube out. It was a bit like of a weird experience, and my throat was so dry, like my mouth was so dry, and I was like, I need some water, and they're like, you can't really drink that much water because it's going to make you sick. So they gave me like a little bit of water like to sip, and I did, and once I sipped a little bit of water, I vomited, like I threw up everywhere. But obviously I did get sick because I was full of like anesthesias and stuff. Anyway, yeah, so instead of staying 2 days in the intensive care unit, I only stayed 1 night. Well, it wasn't even a full, well, let's say I had my surgery on Wednesday, and it was Wednesday morning. By Wednesday afternoon they said, look, we can already move you, but we want to keep you overnight just to be sure, but we can move you to the ward. So yeah, they kept me overnight because they also didn't have a bed in the ward. So overnight I had a nurse only to myself. The whole time in the intensive care unit I had a nurse only to myself. She was my nurse, and I remember she giving me like this bath while she was cleaning me up, because obviously I had to be cleaned up and everything. I was completely asleep, but I remember, you know, her doing this, you know, she was cleaning me and she was talking to me at the same time. She brushed my hair and all that. It was really nice, like the way that she cared for me. And the next morning I had a new nurse. She was nice as well, lovely person. And then because I was going to be sent off to the ward, they had to take off the tubes, so the drain. So basically I had 2 drains, one here and one here, just right under the boobie, and I had another one I think on my neck, and well, there's my car, we'll get there later. Yes, so they took it out. You have to do this breathing thing when they, you know, you have to breathe a certain way when they pull it out, and they literally pull it out, and you're like, you feel it. You don't feel that much pain because you're so high from the meds, so they have really strong medication, so you can't really feel that much. Yeah, so they took it all out, blah blah blah, went to the ward and start recovering. They make you walk straight away, like on the first day that you are in the ward and you're able to walk. They, you know, they come with a physio, they make you walk a little bit. You're always doing like exercises, walking exercise, you have to do breathing exercise, you have to do coughing exercise. So it's really like, it's a lot of things that you have to do that you think you're not going to be able to, but it's so normal. Like when you're there, it's just like, you know, you have to do it and you do it, that's it. They give you like a little pillow, a little towel to hold to your chest, because you just had to take off this tube out of your throat. You need to cough, otherwise, and also because of the surgery, you can't, it kind of accumulates some sort of like I forgot what they said, so it's like a, it's not a catarrh, but it's kind of a catarrh. So it kind of like you have to cough very often to take it out, to clean your throat and everything. So it's kind of painful to cough, obviously, because you've just had your chest opened and all that, but it's okay. It's not the worst thing you'll ever feel, because you're in a lot of meds. You do feel pain, but it's not like what you think you would, like, you know, oh, my chest is open, I'm gonna be in extreme pain. It's not that bad. It is bad, but it's not that bad. Anyway, yeah, so I ended up staying only 5 days in hospital. I didn't stay 10 because they said I was fine enough to go home. Before going home, you need to make sure you go to the toilet. They don't let you go home without you going to the toilet for number 2 because your body, they need to know that your body's working properly. So they do take a lot of blood, and they check on you all the time, obviously. And yeah, so they made me do a stair test because I had to. My house has a flight of stairs, at least my mum's house where I stay in had a flight of stairs, and I had to I had to do the stair test, and yes, they make me go upstairs, and they said, okay, you're fine to go home. So I went home, and I went home with like a big plastic bag full of medication. And yes, so you take your meds for, well, I took mine for 6 weeks, but I later found out that I should have taken mine for 3 weeks and then continue with the paracetamol. But I was taking like a very strong pain. It's not codeine, it's a bit higher, apparently a bit stronger than codeine. Anyway, I was taking that for 6 weeks because my GP didn't want to stop me from taking my tablets, and the person that stopped the tablets was the surgeon that did my surgery when I went for my review. But he did say that the GP is sometimes quite like afraid of kind of like, you know, changing anything because they don't want to be responsible for anything. But usually you're supposed to take that very strong tablets for like 3 weeks, if I'm not wrong. That's what he said. And I ended up taking mine for 6 weeks. So they do cause some kind of like, you know, you do get a bit confused, you get a bit, you know, emotional and all that. However, you also get all this by being, just the fact that you went through a heart surgery already like messes up your emotional, you know, you get so emotional, like not over dramatic, but you get over emotional, if that's a thing. Yeah, so I was, well, I still am very emotional about everything. Sometimes it's like, I feel like people are shouting at me when they're not, just talking to me, and then I start crying and all that, but that's completely normal. It happens. Like, they give you a booklet with all the things that you're gonna go through, and then they also put you through like a rehab, heart surgery, like cardiac rehab, and they not only have the physical side of it, but they also got the emotional side of it. So I am going to start therapy as well, because I've got my first appointment on the 5th of October, if I'm not wrong. So yeah, I'm waiting for that. I think your family or whoever's taking care of you needs to be really patient and understanding. So the first few weeks, you're not going to be able to do anything. At least for the first 6 weeks, you're not going to really be able to do anything. You have a list, like you have a list of things of what you can do and not do week by week. And yeah, I was lucky enough to have my mum helping me through everything. She took really good care of me, and also, you know, there are certain things that you can't lift and all that, you can't use your arms for this or that, blah blah blah. So the first few weeks you're really like depending on someone to help you. Even like with my shower, I had my mum helping me because we don't have showers in my house, we have a bath. So you can't really take a bath. Obviously we do have the shower, but we don't have like we had to get into the bath to have a shower. So you can't really have a bath because you shouldn't, because you're not going to be able to get up. So obviously just the fact that having to go over with your leg to go into the bath and then coming down, my mom had to help me with that as well, to, you know, helping me shower and everything. You are able to wash off your so when they sent me home without any dressing or anything, because I had already been 5 days in hospital with the dressing on and everything. And the day that I was coming home, they took everything out, they cleaned it, and you're able to have a shower with your gel and, you know, carry on taking care of yourself at home. I had a little bit of an infection on my wound. Not an infection, well, kind of. So when the nurse went to cut off the stitches from the drain area, he ended up cutting a bit of my skin. So that was that. So yes, that caused it to open, like it opened like a big hole, and they cleaned it and everything. However, that got a bit infected, and where it got a bit infected, this top one also got a bit infected. But I went back into hospital exactly like the next week, maybe 3-4 days after I was home. I could see that there was something wrong, and then I called them, because, you know, they do give you all the support. So I went to see the nursing hospital again. I had to drive back to Liverpool, just because in Manchester they were not very helpful in Manchester. I tried getting to my GP and my GP was like, oh, we didn't even know that you had a heart surgery, blah blah blah. So it was like, you know, I preferred driving back to Liverpool. I called Liverpool, they said come straight away, we'll clean it. So they took a sample and just to check which bacteria there were, and there was nothing bad. There was just like it was just a bit open. It had just opened a bit, you know, where the stitches were, but the stitches were all done inside. I had no stitches outside at all. So this is opened like this. It's this big, basically because the skin kind of like unglued itself, because they stitch it and apparently they glue it or something like this. So the top skin, because I had this infection, it kind of like opened up a bit. But yeah, I started a treatment straight away. They gave me more medication to take, but within like 5 to 7 days I stopped medication and everything was fine. I just had to carry on with TCP, if I'm not wrong. It's a product that you mix with water just to clean it and dry it and, you know, help it close. Every week I had to send pictures of the wound so that they could see it and, you know, tell you if there was something wrong or not. What else? So basically, yeah, I couldn't really vlog. I couldn't really make much videos because I was not. So when I was in hospital for at least the first 3 to 4 days, I didn't even have my phone because I was not kind of awake or aware of much. I was, you know, you sleep a lot, you feel very tired, you get very sick, but because you've just had an open heart surgery, like it's a major surgery, so it's not like you're gonna wake up and you're gonna have the phone in your hand and be texting and Instagramming people because you don't even remember. Apparently I was asking the same question over and over again. So I don't even remember much of the stuff that happened anyway in hospital. And once I came back home, obviously my family, they did a few videos, took a few pictures, but they were like, well, we're not gonna be, you know, making videos of you when you look high on meds or when you're just confused or crying. Like, we don't want that. Like, you know, we don't want to put you in this position. Even though I wanted to see it, they did make a few, but like I wanted to see, because after everything happened, like after everything was over, I wanted to be able to see it. Anyway, this video is super boring because I guess there's nobody watching. It's just me anyway. I just wanted to kind of like, just because I never found anyone talking about it, I wanted to talk about it myself. It wasn't a very easy experience, but it wasn't the worst experience ever in my life. So well, it was, but but it's just something that happens in it. Yeah, so recovery wise, it is my 7th to 8th, yeah, it's going to be my 8th week this coming week, and everything looks okay. You see it's still a bit purple, but I'm super white as well. So I've got this scar from here to here, yeah, I've got a scar from here to here, then I've got a scar under here and another scar under here. It looks fine, everything is closed. I have gone back to like, not my normal life, but because I'm not working still, but I did go back to doing more things. Like, I'm not at my mum's home anymore. I came back to my own house. I came back this week actually, and yeah, you can do light stuff. You can, you know, you can do light cooking on the 8th week. You can do, there are things that you can do and can't do, so you will have like a little form of things that you can do week by week and what you can't. It's painful, yes, it is painful. Is it painful? It is. But it's a different type of pain. Like, it's uncomfortable more than painful. It hurts, yes, but it's more uncomfortable. So sleeping on your side, for example, it's not really a thing for the entire night, you know, because I used to sleep like this, but now I have to kind of sleep more on my back, just because you wake up in pain and you wake up, you know, uncomfortable, just uncomfortable. And yeah, what else did I want to say? It's emotions, okay. I am seeing a psychologist. I started seeing a therapist, well, psychologist, on Thursday. Today is Saturday. So 2 days ago, it was my first section, and obviously after the surgery, I feel very, so everything kind of scares me now. I've never been this type of person, you know, I've always been like, you know, someone that likes to go out, and I like people and stuff, but the surgery itself, it makes you a bit more scared of things, or you feel a bit afraid of certain stuff, you know, like sounds may be a bit annoying to you. I have a really problem being in the dark now, so when I go to sleep I need to have lights on, just because the dark kind of like, it kind of annoys me that it gives me a funny feeling, like my eyes get to be funny, so I need lights all the time. Very like noisy sounds also like really gets into my nerves, and I get kind of like, I get a bit panic. You know, like a blender or something, so that annoys me. Don't really like being out where there's a lot of people, so like getting a tram, for example. I haven't done that yet because I feel like you know, if I get into a tram, I'm gonna die, because it's too much for me, it's too much pressure. It's just, so I did in the beginning think that all these feelings were related to the medication that I was taking, but once I had a chat on this with the surgeon last week, he did say that it's not the medication itself, you know, the fact that you had a heart surgery and the fact that you were put on a bypass, you know, the machine, the fact that you were on bypass, that kind of influences on your behavior and everything. You know, you get hypersensitive, so like not just the skin, so my skin to the touch, if you so when you touch like this area here, it gets very like, I get a bit nauseous, you know, like even touching the first few weeks after the hospital, like when I was in hospital and after coming out of the hospital, just the fact that my husband used to do this to my hands, it used to make me want to throw up, because it gives you like this funny feeling on your stomach. You get very, very hypersensitive to everything. Other than that, have I seen, like someone asked me the other day, have you seen you know, has it improved already? I have not seen like a huge improvement yet. However, because I do still get very tired and all that. However, one of the big improvement that I have seen is, obviously my body was retaining a lot of liquid, so my legs before, they used to be swollen all the time, and so did my feet. I couldn't sleep on my back, like I couldn't sleep like laying down. I had to have like 4 or 5 pillows behind me to kind of like, I was kind of like raised up. Even if I was sleeping on the side, I had to be raised up so I could breathe. Going up a flight of stairs, like on my mum's house, I wasn't able to do that. I had to stop halfway through. Now I've you know, I've managed to do it like multiple times a day, and yeah, I still sleep, obviously I still sleep with 4 or 5 pillows, but only because it's easier to sleep once you have the surgery. It's easier to sleep just like on your back. You do have to change sometimes position, but you just sleeping on your back is just easier. And I don't think I have anything else to say. I just am going to put some pictures and videos or something. If anyone ever see this video and ask a question, you know, I'll answer. Thanks, bye.